Hello again. This is Dr. Pam Obare. I'm a doctor in nurse practice, and we are discussing today about women. Um, the thing is, with women, they don't have a lot of questions. But one thing I know is that you don't want to miss anything. That's the goal with this thing. You don't want to miss any question. Absolutely not. So I'm gonna go through this quickly, and then also if you need more information, I have a small book, a PowerPoint book, and I also have some courses. Of course, you know. Okay, let's do this. So in pregnancy, we need to know that if a woman is breastfeeding, they have a progestin only pill that is safe for women who are breastfeeding. Oh God, I can't pronounce. Progesterone only pill that is taken by women who are pregnant, who are breastfeeding. Also, that brings me to another thing. In contraceptive, remember, if a woman is over 35 and they are smokers, you cannot give them contraceptives. They have a risk of blood clots, DVTs, and all that. So if you have a question in exam, a woman is 35 years old, is a smoker, no progesterone. She can use condom, but no pills. Do not give her pills. Also, with contraceptives, what are the two things that in contraceptive that do not have hormones? Copper T does not have hormone. Copper T, you know those things, copper T, and also condoms. They do not have hormones. So remember that, guys. What are the benefits of oral contraceptives? Some of them, they regret heavy menses. They prevent pregnancy. You know that. So what about depot? The depot, we give it every 3 months. Usually in the clinic we give younger people. But one thing you should also be aware, you cannot give these kids who have bulimia and anorexic kids. You have to, because it potentiates osteoporosis. So also, if you're giving them, remember to give them vitamin D. Let me see what is it. Okay, what if a girl comes to your office? They say they missed to take their contraceptive. The first time, if you miss the first time, you tell them to take the following day to take the pill. Take 2 pills, but continue using condoms until the end of the season. The recent CDC says if somebody misses twice, they miss today, they're taking the pill, tomorrow they miss taking the pill, they'll take 2 and 2 and throw the rest away and use condom the rest of the time. Previously, that was not the case. All right? So, when do these young people need parental consent? When you're doing for them a physical, they need parental consent. But other things, believe you me, contraceptive, they do not need parental consent. Pregnancy, they do not need parental consent. Dysmenorrhea, yes, they need parental consent because you have to treat them. STIs, if they have sexually transmitted disease, they do not need parental consent. Okay, there's things that you have to remember, guys. Anytime a childbearing person comes to your clinic and they want contraceptives or they are saying they're having abdominal pain, always check pregnancy. Always check pregnancy before you subscribe anything to them. So what are the signs of pregnancy? That is something you have to cram it. I don't know, you have to write in a piece of paper because that is something you have to know. And this is how you know. Pile them in three piles. Pile 1, pile 2, pile 3. Pile 1, presumptive. All what the patient tells you, the tenderness of the breast, the feeling of how, feeling heavy and whatever, that is presumptive. And then probable. Probable, I remember it this way. All those Goodell sign, Chadwick sign, Hager sign, and the HGC sign. Also, all those are in the probable. And then the other one, which is positive, is what as NPs, doctors, what we see in the ultrasound. So if you know that, to separate the three, so the questions, if they give you pick and choose questions, you are going to be able to know which one belongs to where. The one that the patients tell you, that is presumptive. Everything the patient tells you is presumptive. They are assuming. Probable are all those things, the Hager sign, the Goodell sign, the, quickening of whatever. All those are probable. And then positive signs. The positive is us. Positive is providers. So that one, if you remember that, you're good to go. Also, guys, you have to remember in pregnancy. You have to know where the pregnancy is. If you don't know, go check, Google check. At 12, it is on pubic symphysis. At 16 is between the pubic symphysis down there and the umbilicus. At 20 is umbilicus. Anything after 20 is either you add 2 or subtract 2 between. So let's say it is, they give you in the exam, they say a patient is 32 weeks. Where do you think is she, the fundal height? Where is the fundal height? We are talking about the fundal height. Where is she right now? So when they talk about 32 weeks, the fundal heights can either be 33 or 34, or it can be 31 or 30. So you add 2 up, 2 down. That's it. All right, guys. Any woman who is pregnant, if they have a UTI, you are going to treat it as complicated UTI, as a complication. Any woman pregnant has a UTI, you have to treat it as a complication. And for normal people, it has to be over 100,000, but for pregnant, it's 10. All right, what else? Pregnancy doesn't have a whole lot. You have to remember about placenta abruption. It's separating or bleeding. It is painful. Usually it happens about 3rd trimester. The patient has board-like abdomen. Send them out. Placenta previa is painless bleeding. It is not painful. So you have to know the difference between placenta abruption, which is painful, and placenta previa, which is painless. Remember that. And both of them, send them out. What about a patient comes, you just got a baby, and now they are having mastitis? You have to treat them with doxycycline. But one important thing you have to educate this patient, continue breastfeeding. Don't stop. What about pap smears, guys? Pap smear, even if a patient is sexually active, they have been running all over the place, and they're below 21, you are not going to do a pap smear. We start doing pap smear after a patient is over 21 years, okay? So remember that. And after that, every 3 years, okay? What about if the pap smear is LSIL or HSIL? Those things, you have to know them. You have to send them for a colposcopy. You know that. Also, guys, genital warts. Genital warts. What is the vaccine we give for that? Remember that vaccine they give at 9 months? Gardasil, that vaccine, it prevents those carcinogenic things. I don't even know what to call them. 16 and 18. You know, the HPV 16 and 18, that's what it prevents. So, if somebody has genital warts, what do we treat with them? We treat them with TCA acid, which is trichloroacetic acid. Go check it out. What else haven't I talked about pregnancy? Let me see. When do we check for alpha fetoprotein? At week 16 and 20. Okay, don't forget that. Let me see anything I haven't talked about. What about this came in? I don't know how it came in, but what about Down syndrome? Kids with Down syndrome. As an NP, if you find a question asking about kids with Down syndrome, make sure that the kids are assessed, because usually their neck is unstable. Make sure the kids are assessed before you send them for sports. Okay? I think that's about it. Oh my God. Don't forget, guys. Don't forget about NIGO. I can't even pronounce it. NIGO rule. How somebody gets pregnant, they would always have that one question about determining the date of birth if somebody is pregnant. The one we do, you had 7, the day they missed their missus, plus 7 plus 9 months. I like that one than the other. There are 2 ways you can do it. The one you add 7 plus 9 months and get the answer. And usually the answers are going to be either September, November, December. So you have October, November, December. October, November, December. So it's either they were pregnant January, February, or March. Just remember, know that you had 7 days plus 9 months, and you get the answer. It's as simple as that. 7 days plus 9 months, you get the answer. Most people do most people do the second one, where you add 7 days and minus 9 months, and I don't like to go backwards. I like to go front. So guys, I think that's about it. That's about with pregnancy. It's easy. Easy. Let me see something I did not say. Okay. So anyway, if you want more information, I have a lot of information in my website, and I'm going to share it. Thank you for listening to me.